Good day everyone, my name is Dr. Samira Gopi. I am a diabetes specialist and I currently work in the Northwest Regional Health Authority of Trinidad. Today, I will be speaking to you regarding important information on the condition diabetes mellitus. What is diabetes mellitus? This is a condition where the blood glucose or sugar levels in the body are high. Insulin, a hormone produced by the pancreas, is necessary to transport glucose or sugars into the cells of the body. Diabetes mellitus can be divided into two types. In type 1 diabetes, there is a lack of insulin in the body. In type 2 diabetes, there is insulin production, but the cells of the body are unable to use the insulin properly. Both these conditions result in high sugar levels. High sugar levels cause harm to the body. Acutely, high sugar levels cause excessive thirst and urination, blurred vision, and a general feeling of tiredness. Over time, when the sugar levels and cholesterol levels or fats are high in the body's blood vessels, this leads to a condition called atherosclerosis, or blocked arteries. When the blood vessels are blocked, this leads to serious and devastating consequences. High sugar levels can affect the large vessels of the body. Firstly, when blood vessels that supply the heart muscle are blocked, this leads to coronary artery disease or a heart attack. Secondly, when the blood vessels which supply the brain are blocked, this can lead to a stroke. Thirdly, when the blood vessels which supply the lower extremities or leg are blocked, this leads to a condition known as peripheral arterial disease. This is characterized by poor healing wounds in the legs or feet and the development of ulcers. If left untreated and in the setting of high sugar levels, this can progress to something known as gangrene or death of the tissue or muscle in the feet, which will necessitate amputation of toes or even a lower limb. Moving along now, high sugar levels can also affect the small vessels of the body. Firstly, the blood vessels in the back of the eyes can be affected. This condition is known as diabetic retinopathy. If left untreated and if the diabetes remains uncontrolled, this can eventually progress to blindness. Secondly, the small blood vessels in the kidney can be affected. The kidneys are responsible for removing toxins from the body. When the small blood vessels in the kidneys are affected, there is spillage of protein into the urine. If left untreated and if sugar levels remain high, this can eventually progress to kidney failure, and this means that the patient will have to be on dialysis. Thirdly, the small vessels in the nerves of the feet can be affected by high blood sugars. This leads to a condition known as diabetic neuropathy. An affected patient has the sensation of pins and needles in the feet. Remember, uncontrolled diabetes can lead to a heart attack, stroke, limb amputation, eventual blindness, and kidney failure. The goal is to avoid such complications. So, how do we treat diabetes mellitus? A healthy diet is important. Regarding diet, carbohydrates raise the blood sugar. Examples of carbohydrates are bread, potatoes, roti, rice, and pasta. These food items should be consumed in moderation. Sugary beverages such as regular soft drink, juice, sweetened tea should be stopped. Intake of concentrated sweets should be reduced. Examples of concentrated sweets are cakes, chocolate, regular ice cream, sweet pastries, and cookies. Read food labels on any snack, food, or beverage you are about to consume. Excess snacking on food beverages with a high carbohydrate content will raise the blood sugar. Exercise and physical activity are important components of a healthy lifestyle. Regarding exercise, moderate intensity exercise, for example, brisk walking, is recommended. This should be done for 30 minutes a day on 5 days per week. For a healthy lifestyle, it is recommended to practice portion control for your meals and keep up your physical activity. We now look at treatment of diabetes mellitus. Type 2 diabetes mellitus can be treated with either oral medications, which are pills, or insulin. Each medication has benefits and there may be side effects as well. Based on your blood sugar levels and other factors such as your kidney function, you and your healthcare professional will decide on which medication is appropriate for you. Remember, your health is your responsibility and your health is in your hands.